how the pollution is affecting the society at the present moment?
So like I was saying before, pollution or environmental risk factors are responsible for almost a quarter of the global burden of diseases today. And amongst those, one of the leading risk factors is air pollution. And air pollution is known to be responsible for almost 1.2 million deaths, and much of that is due to pollution in the outdoor air. So what we call as ambient air pollution, but also the indoor air pollution. And in terms of impacts on health, most of us think that because we are breathing in air, it is impacting lung health. It is very true that it does make respiratory health worse for a lot of people, especially vulnerable populations like young children and elderly individuals, but also for all age groups that are exposed to poor quality air. But apart from respiratory effects, increasingly we are having evidence now that exposure to poor air quality for long periods of time has impacts on almost every other organ system in the body. It causes impacts on cardiovascular health, it can impact brain health, so strokes, heart attacks. In terms of exposure of pregnant women also, it has been shown that there can be adverse birth outcomes. So low birth weight, stillbirth, miscarriages. There are increasing bodies of evidence, research evidence now showing that poor air quality does impact health for all age groups and all genders.
Do you think that this air pollution is increasing the rate of heart attacks and other things?
So like I just said, yeah, it is there now. There is increasing evidence showing that air pollution can be a reason for heart disease. Intermediate risk factors, for example, for heart disease are high blood pressure. So we have in our own research shown, for example, we have built a model for the city of Delhi and Chennai, where we have estimated exposure to particulate matter, PM 2.5, for the last 10 years. And we have done the association of exposure to particulate matter to blood pressure in our Delhi study population, and it has shown that every 25 micrograms increase in particulate matter, PM 2.5, can increase the blood pressure by 3 to 5 millimeters of mercury. Now that seems like a small figure when we look at it, but in 120 by 80 millimeters of mercury becoming 123 by 83 millimeters of mercury, how does it matter? But in the long run, it means that more and more people at the population level will become hypertensive. More and more people will be going to the hospitals and doctors because of the need to manage their hypertension. So for a country like India, who are already not very well equipped in terms of healthcare systems, we saw that during COVID now, if we are able to address the upstream determinants, address our air quality, then in the long run, less and less people will get affected by these health outcomes like hypertension, diabetes. We are increasingly showing now that air quality has impacts on very many health indicators, including things like hypertension and diabetes.
But ma'am, right now the state government has taken initiative to bring out electric vehicles and battery vehicles, like small vehicles and buses also,
right,
which are running by battery and electric. So do you think that this will decrease the air pollution and will give a soothing life?
See, I think for countries like Kolkata and New Delhi, transport definitely is one of the major causes of pollution in the city, and that is the traffic congestion. Not just the congestion, there's more and more vehicles, more vehicle ownership. Every middle class family has at least 2 cars. People have stopped using public transport, so disincentivizing ownership of private vehicles. We don't need 2-3 cars. There are people who can show the way by using public transport. Then you're reducing the use of private vehicles, which are guzzling fossil fuels for their petrol, diesel, all of that are polluting fuels. Think about the number of vehicles that are standing at the traffic signals, idling. They don't switch off their engine. There is tailpipe exhaust, and especially for children, like school children, the traffic bus, the buses, school buses themselves maybe are idling at traffic signals. All of those are little steps. I mean, transitioning to more friendly forms, sustainably forms of transport, environmentally friendly forms of transport like electric vehicles. Every step is important. I think in the long long run will help us to address the issues. It's a drop in the ocean maybe, but addressing the sources is very important, including something like transport.
And ma'am, in the just now you were telling that where there are many countries who participated in the this thing eco-friendly environment.
Yes.
Where India did not participate, unfortunately.
No, that was something, it was a commitment to decarbonize our health sector. So it was an initiative that was started just a few months before that COP conference in November last year in Glasgow. So some countries had the opportunity to move the processes that requires making that commitment, but there are other countries that are a little slower coming on board, which is fine because we are not all at the same state. So there are some countries who have already managed their health systems, are managing to deliver healthcare. For a country like India, we are talking about universal healthcare. Everybody needs access to healthcare, but if we also start saying that we have to reduce our emissions, it may not work to do both at the same time, but we can take little steps right away. We need not wait. So we talk about the roadmap to decarbonization for the health sector. That roadmap, the trajectory through which you reach that low carbon health system need not be the same for a developed country versus a developing country. A developed country has to straight away start reducing their emissions. A country like India, a developing country, which still needs to grow its health system and cover the entire reach of its population, can take it little slowly.
I think that the population, India's population is a big barrier for getting it activated.
I wouldn't say that.
Because Australia has already started decarbonization. Because they are replacing the bulbs, they are replacing the showers.
We are doing it in India as well. I don't think I would say that population is a reason, because it's making that population, whatever that population, small or big, if you make them aware, sensitize them of the little steps that you can take at individual level, at household level, at healthcare facility level, and of course work with all the other sectors. It was rightly said, like, every sector, transport, government offices, private offices, everybody can do their bit. And I think that's important, working individually in your own domain, in your own sector to reduce your own climate footprint, but also help other sectors. For example, the healthcare sector cannot do this alone because we are dependent on transport, we are dependent on energy, we are dependent on water, on the food systems. So talking to all the other sectors and those sectors helping the health sector along is what will be the magic bullet. I think every step of the way we need intersectoral coordination.
So that means you are telling that every sector has to be aware and they has to come forward with the awareness.
Definitely. So I did mention the initiative called Race to Zero, which is the UN initiative for decarbonizing, every sector. So it is not only the health sector. There are partners who have come onto this initiative from every sector: transport, energy, industry. Everybody is onto this Race to Zero initiative. It's not only health sector. I was mentioning about the health sector because we work with the health sector. So the health sector ministries from 50 countries had committed, and there are more coming on board. In India, it's a challenge because we have both private as well as public health systems. So we have to reach everybody. And we are doing that effort through our own initiative, through the Government of India's program, National Program for Climate Change and Human Health. We are working through that program to reach the public health system in India about this whole concept of climate smart healthcare. But we also have our own network of private hospitals also. It is an India arm of the Global Green and Healthy Hospitals. It's an initiative that is run by Healthcare Without Harm, an organization, an NGO that is present, that has a global presence. We are their India partners. So we have established the India network also of that Global Green and Healthy Hospitals called HELP. Actually, the acronym is HELP, for Health and Environment Leadership Platform. And through that network, we have today about almost 80 members, which is hospitals, individual hospitals, as well as associations of hospitals. So we touch in our network close to 8,000 hospitals in India. So we are continuously sensitizing and talking to them. Like this effort here today in Medica hospitals, we are trying to do this everywhere, but we are also trying to reach a larger number through webinars. The online mode has become easy to reach and more people. So we are working towards every step counts.